Magandang gabi ho sa inyong lahat. Ako ho'y laking Mindanao. Subalit ho ang may nagduduloy ho sa akin ay dugong Batanggenyo. Kaya I'm very happy to be with you ngayong gabi. Let me first recognize our Honorable Vice President, Bingay, Honorable Senator Ralph Recto, Honorable Governor Vilma Santos, Vice Governor Mark Libiste, of course, Honorable Sopronio Ona Jr., ang Presidente ko ng League of Municipalities. Gusto ko rin hong batiin ang ating hong pinsan na si Sopronio at si Ona. And of course, Justice Sandoval and former Justice Postol. Meron po ako ditong prepared speech, subalit po ay dadaan ko na rin yung sa Tagalog ito. You know, first time that I met our President, President Pinoy, was when interview niya ako for this job. That I am here today as your Secretary of Health. And even as a practicing surgeon and as a director of NKTI, wala akong nagkaroon ng pagkakataon na magkakita ko kami. I did not have a chance to meet him when he was a senator or even as a congressman. And I did not have also the opportunity to treat any of his relatives. So during the interview, ang tanong ko niya sa akin, Doktor, ano magagawa natin na mga 30% ng ating kababayan ay namamatay without seeing a health worker? Ang sabi ko sa kanya, the problem is, ang karamihan mo talaga ng ating mga kababayan ay walang pera because of that no access to quality health care. Now, as your Secretary of Health, I have committed to our President what we want to achieve for the next 6 years. What we want is to have universal health care for all Filipinos. And making this dream a reality is a daunting task. And this is a tall order, no doubt. But kayo ho, actually, the League of Municipal Mayors will be the cornerstone if we are to succeed in this effort. But first, let me ask you, what is universal health care? Universal health care means that all Filipinos have equal and fair access to affordable health care at the time and place of need. This we seek to achieve primarily by strengthening the existing national health insurance program. Ako ay nagagalak na nag-uusap kami ni Ralph kanina, and he said he is very interested, hoping and sharing the Committee on Health dahil ho, ang kanyang commitment is how to help healthcare financing, which is going to be through PhilHealth. What we want is that at least 85% of our countrymen will be covered by PhilHealth by 2013. That is 2 years from now or 3 years from now. Alam mo niyo, PhilHealth, the mandate was that all Filipinos would be enrolled to PhilHealth within 15 years. Since it was established in 1995. So actually, dapat ho ngayon. However, Yun hong National Demographic and Health Survey mentions na 38% lamang pala ng mga Filipinos are covered by PhilHealth today. And the President even during his Ona speech mentioned that actually 54% only of the Filipinos are covered by PhilHealth, although PhilHealth claims that 85% of Filipinos have PhilHealth today. At the same time, the study ng PhilHealth is that wala pa hong 30% ng ating gastos sa pag-na-ospital ang covered by PhilHealth. So actually, 70 to 80% is actually out of pocket. Ibig sabihin, we have to get it from our own pocket when we get sick. Well, whatever the case, we want to improve coverage of PhilHealth, and we are ready to take drastic measures to achieve it. Ngayong October 2nd, in 2 months' time, Sabado ho yun, we will be launching a National PhilHealth Enrollment Day. Meron hong ginawang means test ang Department of Social Welfare and Development, identifying ho the true poor Filipino. And ang kanilang estimate is that 4.7 million Filipino families belong to this very, very poor segment of our population. At sisimulan mo natin October 2, at least on that particular day, magkakaroon tayo ng so-called PhilHealth Fair, so that we will enroll. Wala na hong so many requirements. Pag nasa database kayo ang ating kababayan, on the DSWD means test, they will be automatically enrolled by PhilHealth. And at the same time, they will be able to right away use yung PhilHealth coverage. We are also currently working with PhilHealth and other government agencies and civic organizations na tumulong ho. Kaya ho napakahalaga ang aking hingi sa inyong mga mayors na tulungan para ho itong National PhilHealth Day will be successful in all the regions and provinces of the country. Likewise, we will be looking at the informal sector. Itong informal sector are those whom we believe can pay the minimum, more than the minimum, either yung 100 pesos per month na premium or even higher, na dapat ho ma-enroll sila. At ito ho ang isang malaking problema is how to get those who can afford to pay the premium and yet will not enroll themselves unless they are literally forced to. Kaya ho nag-usap ho kami ni Secretary Luistro that sa next school year po, lahat ng mga estudyante bago ma-enroll will have to show that they or their parents are covered by PhilHealth. Para lang hong arm twist sila na mag-enroll sa PhilHealth. And if sasabihin mo nilang nahirap sila, then titingnan natin kung ang kanilang pangalan ay nasa database, in which case they will be automatically enrolled. At kung hindi naman, then magbayad ko sila. At the same time, PhilHealth coverage will be useless if we don't have adequate services in our hospitals and our rural health facilities. Last week, I was in Davao and Cebu, and I saw the state of our health facilities. Pumunta ako sa isang barangay station sa Digos, and napaka-awa ko ang sitwasyon. Kulang ng gamot, kulang ng lugar, kulang po ng equipment. So it's very important that at the barangay level, at the district level, ito ho ang dapat nating bigyan ng attention. As a matter of fact, the Philippines is a signatory to the Millennium Development Goals na kailangan mong ibaba natin ang ating maternal and infant mortality to what it is today to almost 1/2. Tayo ho, I will be judged by what we are going to achieve by 2015, and the cornerstone of being able or being successful sa paraang ito ay hindi ho sa mga medical centers, kundi at the local levels. Kaya ho napakatindi at napaka-importante ang participation and commitment as well as support of the local municipal mayors. Achieving universal healthcare entails being able to provide quality service, especially to the poor and marginalized. Noon hong naglibot ako sa mga ospital, both sa provincial, even sa ating regional hospitals and ating mga district hospitals, it was obvious right away that PhilHealth has not been successful. Paano ho? Nung tinatanong po sa mga pasyenteng, lalo na sa ating district hospital, how many percent ang merong PhilHealth? Nakakasakit ng loob. Because ang mga sagot 15%, 12%. When actually PhilHealth should really have addressed essentially these poor and marginalized Filipinos. So ang nangyayari ko pala, ang may PhilHealth ay lahat pupunta sa private hospital because what is being covered by PhilHealth are mostly those in general are able to afford the healthcare. At yung talagang mahihirap are still unable to have the care. And when I was in Cebu the other day, pumunta ako sa isang health station. Meron ng doktor, meron ng nurse, may dentist, midwife. Ang problema ko naman, napaka-stricto naman pala ng PhilHealth. For 2 or 3 years, they have been asking to be accredited and they were still unable to get the accreditation. So ang nangyayari ko, hindi pa rin sila natutulungan. And aside from PhilHealth, however, there is another strategy that we can employ to achieve universal health care. And I'm sure kayo kung nakikinig noon sa speech ni President Roy, in the first few paragraphs, sinabi ka agad niya yung public-private partnership. The phrase was mentioned several times because this is a major way to overcome the perennial problem of the lack of resources for healthcare. Health facility enhancement is one area where the private sector can help us. Our experience was the National Kidney and Transplant Institute has shown very well that this can work. But of course, public-private partnership is not limited to hospital enhancement alone. Public-private partnerships can provide solutions to a wide array of maladies afflicting the health sector. I'm sure si Ralph will say a few words about itong area on public-private partnership, and I'm sure most of you are already familiar with that. Ang Batangas ho is a very progressive province and has achieved much not only economically but also in terms of your health outcomes. This shows that Batangas and the different municipalities are models for other provinces and municipalities in terms of implementation of healthcare programs. Thus, it is very apt that one of the aims of the League of Municipalities of Batangas is to make research-based and effective good practice for good governance. Ako'y nagagalak nung nakita ko kung research pala ho is one of the mission ng inyong organization.